Which of the following situations requires the food handler to immediately stop working and report to the manager? A. Diagnosis of jaundice within the last week. B. Occasional sneezing. C. Minor cut on the forearm. D. Wearing a new uniform without gloves. Answer: A. Jaundice may indicate hepatitis A, which is a reportable illness. Food handlers with jaundice within the past 7 days must be excluded and reported to the regulatory authority. A chef stores raw fish above ready-to-eat vegetables in a walk-in cooler. What is the primary violation? A. Poor temperature control. B. Lack of labeling. C. Incorrect storage order. D. Cross-contamination prevention. Answer: C. Raw fish should be stored below ready-to-eat foods to prevent drips and contamination. Which cleaning method is most effective for removing baked-on food debris from stainless steel pans? A. Soaking in lukewarm sanitizer. B. Using a high-pressure cold rinse. C. Wiping with disinfectant towels. D. Scrubbing with an abrasive pad and detergent. Answer: D. Scrubbing with an abrasive pad and detergent effectively removes stuck-on food residue from cookware. How often must a food contact surface that is in constant use be cleaned and sanitized? A. Every hour. B. Every 2 hours. C. Every 4 hours. D. Once per shift. Answer: C. ServSafe guidelines require cleaning and sanitizing food contact surfaces at least every 4 hours when in continuous use. Which of the following represents an imminent health hazard that requires immediate closure of a food operation? A. Broken freezer door. B. Pest infestation in dry storage. C. Water leak in janitor closet. D. Cracked kitchen tile. Answer: B. A pest infestation poses direct contamination risks and is considered an imminent health hazard requiring immediate corrective action or closure. What is the minimum internal cooking temperature for shell eggs served immediately? A. 135 degrees Fahrenheit 57 degrees Celsius. B. 145 degrees Fahrenheit 63 degrees Celsius. C. 155 degrees Fahrenheit 68 degrees Celsius. D. 165 degrees Fahrenheit 74 degrees Celsius. Answer: B. Shell eggs that are cooked for immediate service must reach 145 degrees Fahrenheit for 15 seconds to ensure safety. Which food item should never be served at a nursing home or care facility? A. Pasteurized apple juice. B. Deli sliced turkey. C. Rare steak. D. Raw seed sprouts. Answer: D. High-risk populations should avoid raw sprouts due to the risk of Salmonella and E. coli. What is the first step in implementing an active managerial control system? A. Develop training programs. B. Identify common foodborne illness risks. C. Monitor critical control points. D. Purchase new equipment. Answer: B. Active managerial control begins with identifying risks that can lead to foodborne illness in your operation. A delivery truck arrives with milk at 49 degrees Fahrenheit. What should the receiving manager do? A. Accept the milk and store it quickly. B. Stir the milk to reduce temperature. C. Reject the milk delivery. D. Cool the milk with ice. Answer: C. Milk must be received at 45 degrees Fahrenheit or lower. 49 degrees Fahrenheit is above the safe receiving temperature, so it must be rejected. What food preparation technique increases the risk of Clostridium botulinum contamination if done improperly? A. Pickling. B. Grilling. C. Freezing. D. Vacuum packaging. Answer: D. Vacuum packaging creates anaerobic conditions that support C. botulinum growth if time temperature control is poor. A manager uses a chlorine sanitizer at 100 degrees Fahrenheit. What is the correct concentration range for it to be effective? A. 10 to 50 ppm. B. 50 to 100 ppm. C. 100 to 200 ppm. D. 150 to 400 ppm. Answer, B. For chlorine sanitizer at 100 degrees Fahrenheit, the concentration must be between 50 to 100 ppm to be effective. What is the best method to ensure a cleaning chemical is not accidentally used on food? A. Store all chemicals on food prep tables. B. Use generic containers for all chemicals. C. Label all containers with chemical name. D. Use the same cloth for all surfaces. Answer, C. Proper labeling of chemical containers is essential to prevent accidental food contamination. Which is the most effective way to prevent backflow of contaminated water? A. Air gap. B. Screened vent. C. Rubber stopper. D. Water filter. Answer, A. An air gap is the only fail-safe method to prevent backflow in plumbing systems. How should single-use gloves be stored? A. On counters for quick access. B. Inside chemical storage rooms. C. In original packaging away from contamination. D. Hanging from apron hooks. Answer, C. Gloves must be stored in their original packaging in a clean, dry place to avoid contamination. What must be available at all handwashing sinks? A. Bleach solution and thermometer. B. Soap, hot water, and hand dryer or towels. C. Aprons and gloves. D. Sanitizer bucket and test strips. Answer, B. Handwashing stations must have hot water, soap, and a method for drying hands. Which of the following is most likely to cause a foodborne intoxication rather than an infection? A. Norovirus. B. Salmonella. C. Staphylococcus aureus. D. Hepatitis A. Answer, C. Staphylococcus aureus produces toxins in food, leading to foodborne intoxication. The correct way to reheat food for hot holding is A. To 135 degrees Fahrenheit within 4 hours. B. To 165 degrees Fahrenheit within 2 hours. C. To 145 degrees Fahrenheit for 15 seconds. D. To 155 degrees Fahrenheit for 20 seconds. Answer, B. Reheated food must reach 165 degrees Fahrenheit within 2 hours before being placed in hot holding. A server touches the rim of a clean glass while placing it on the table. What is this an example of? A. Proper handling technique. B. Acceptable customer service. C. Cross-contact. D. Contamination. Answer, D. Touching the rim of a glass contaminates the part that contacts the customer's mouth. The most effective way to monitor the temperature of a refrigerator is A. By placing a thermometer inside. B. Checking external compressor readings. C. Opening the door and feeling the air. D. Asking staff to guess the temperature. Answer, A. Thermometers placed in the warmest part of the unit provide accurate internal temperatures. What action must be taken when there's a grease fire in the kitchen? A. Use water to cool the surface. B. Turn off the gas and use a Class K extinguisher. C. Pour ice on the flames. D. Cover with a damp cloth. Answer, B. Class K extinguishers are designed specifically for grease fires in commercial kitchens. Which of the following best describes the first in, first out, FIFO method for food storage? A. The item that was cooked first must be served first. B. The item with the shortest shelf life should be used last. C. The oldest inventory is used before newer stock. D. The inventory is organized by alphabetical order. Answer, C. FIFO, first in, first out, ensures that food products are used in the order they were received, minimizing spoilage and waste. It's a standard practice in food safety to rotate stock properly. What is the minimum time and temperature required to sanitize items in a high-temperature commercial dishwasher? A. 165 degrees Fahrenheit for 10 seconds. B. 171 degrees Fahrenheit for 30 seconds. C. 180 degrees Fahrenheit for 1 minute. D. 200 degrees Fahrenheit for 15 seconds. Answer, B. For manual hot water sanitizing, water must be at least 171 degrees Fahrenheit and items must be immersed for at least 30 seconds. In mechanical high-temp dishwashers, the final rinse must reach 180 degrees Fahrenheit. A food handler begins to prep salad without washing hands after handling raw chicken. What is the risk involved? A. Mold growth. B. Cross-contamination. C. Chemical contamination. D. Food oxidation. Answer, B. Handling raw chicken followed by ready-to-eat food like salad without washing hands can transfer pathogens, such as salmonella, leading to dangerous cross-contamination. Which of the following is the best practice for cooling a large batch of hot soup safely? A. Place it in the walk-in cooler uncovered. B. Let it sit at room temperature until cool. C. Divide it into shallow pans and refrigerate. D. Freeze it immediately in deep containers. Answer, C. To cool food safely, reduce its temperature from 135 degrees Fahrenheit to 70 degrees Fahrenheit within 2 hours, and then to 41 degrees Fahrenheit or lower within 4 more hours. Shallow pans allow rapid cooling by increasing surface area. Which situation requires a food handler to be excluded from work rather than just restricted? A. Diagnosed with norovirus. B. Has a sore throat and fever. C. Has a cut on the finger. D. Is sneezing in the food prep area. Answer, A. Food handlers diagnosed with norovirus, Salmonella typhi, hepatitis A, or Shigella must be excluded from the operation and reported to regulatory authorities. When receiving fresh poultry, which condition would cause it to be rejected? A. Firm flesh and mild odor. B. Temperature of 41 degrees Fahrenheit. C. Packed in self-draining crushed ice. D. Purple or green discoloration around the joints. Answer, D. Signs of spoilage in poultry include abnormal coloring, stickiness, strong odors, and sliminess. Fresh poultry should be clean, firm, and free from discoloration. What is the maximum number of days ready-to-eat TCS food prepared on-site can be stored at 41 degrees Fahrenheit before being discarded? A. 3 days. B. 5 days. C. 7 days. D. 10 days. Answer, C. Ready-to-eat TCS, time/temperature control for safety, food prepared in-house must be labeled and used or discarded within 7 days if held at 41 degrees Fahrenheit or lower. What is the most effective method to prevent foodborne viruses from contaminating food? A. Rinsing all fruits and vegetables thoroughly. B. Cooking food to 165 degrees Fahrenheit. C. Keeping food covered during storage. D. Practicing proper hand hygiene. Answer, D. Viruses like norovirus and hepatitis A are primarily spread through improper handwashing. Hand hygiene is the most effective barrier to viral contamination. A food establishment uses a surface sanitizer that leaves a sticky residue. What action should be taken? A. Dilute the sanitizer with water. B. Use a clean cloth to wipe off the residue. C. Stop using it and refer to the manufacturer's instructions. D. Increase the contact time for better effect. Answer, C. Improper chemical usage, like sticky residue from sanitizers, may indicate misuse or overconcentration. Always follow the manufacturer's directions for safe and effective use. A delivery arrives with shellfish tags dated 10 days ago. When must this shellfish be discarded? A. After 7 more days. B. 21 days after harvest. C. On the day the shellfish is used. D. 90 days after receiving. Answer, B. Shellfish tags must be kept for 90 days, but shellfish must be discarded 21 days after the harvest date to ensure freshness and reduce the risk of shellfish poisoning.